Understanding CFTR mutations. What does carrier status mean? What does it really mean to be a carrier of cystic fibrosis mutations? Cystic fibrosis, often abbreviated as CF, is a genetic condition caused by mutations in both copies of the cystic fibrosis transmembrane conductance regulator gene. This gene plays a vital role in regulating the movement of salt and water in and out of cells. When both copies of this gene are mutated, a person develops cystic fibrosis, which can severely impact the lungs, pancreas, and other organs. Now, let's dive into what carrier status means. A person who is a carrier has inherited a mutation in just one copy of the CFTR gene, while the other copy remains normal. This means that carriers do not have cystic fibrosis and typically do not experience any symptoms. The presence of one functioning gene copy is usually sufficient to produce enough CFTR protein to maintain normal cellular function. Genes come in pairs, with one inherited from each parent. So, if one parent is a carrier and the other has two normal copies of the CFTR gene, their child will not inherit cystic fibrosis. However, if both parents are carriers, the situation changes. In this case, there is a 25% chance that their child will inherit mutations from both parents and develop cystic fibrosis. There is also a 50% chance that the child will be a carrier like the parents, and a 25% chance that the child will inherit two normal genes, meaning they will neither have cystic fibrosis nor be a carrier. Understanding carrier status is particularly important for family planning. Carrier testing is available through genetic screening, which can identify many common CFTR mutations, although it may not detect all possible mutations. The effectiveness of these tests can vary based on a person's ancestry and the specific mutations being screened. Interestingly, while carriers do not have cystic fibrosis, some studies suggest they might have a slightly increased risk for certain CF-related conditions, such as sinus infections or mild respiratory issues. However, these risks are generally much lower than those faced by individuals with cystic fibrosis, and research is ongoing in this area. In summary, being a carrier means having one mutated CFTR gene without having cystic fibrosis itself. Carriers are typically healthy but can pass the mutation to their children. Understanding carrier status is crucial for assessing the risk of cystic fibrosis in future generations and making informed reproductive choices. Genetic counseling is highly recommended for carriers to fully understand their risks and options.